Okay, we are here in Fort Myers, Florida. It is January 26th or something like that.
26th.
26th. So we have a happy patient from Tampa area, but he had a very unique kind of floater. It blurred your vision when you were reading, looking down mostly,
Yes,
or what?
vision, driving, all the time.
And you had been to an ophthalmologist or not up
I
there?
had been checked out. Basically, everybody told me they could not much you could do. Hopefully, it will sink and move and it would, be out of the sight vision, but it just
Yeah.
never did.
And how many years ago was it?
It was over almost 2 years.
2 years.
For the
And,
living.
and the type of floater you had was very unusual. It's actually, here's a video of it. It's behind the natural crystalline lens of the eye. I think these are the most difficult to treat adequately because they're so close to delicate structures. I mean, we're working in this video probably, I would say 2 millimeters from the lens, maybe less.
Well,
Safely, I
Wow.
might add. If you hit the lens of the eye, you can of course get cataract, but we have not done so. And as you can see, you got to hit this thing on the fly, which makes it very, very, very
Yeah.
difficult. I mean, wasn't I tired after doing your
The third
case?
one, I know for sure.
Yeah, so we actually
Late in
had
the
to do
day.
we had to do 4 sessions.
Right.
After the first session, there wasn't much difference, was
Well,
there?
first was excellent.
Oh, the first one was
First one.
excellent.
It
Oh.
was big difference.
Oh, okay. Well, I didn't think I was so great the first time, but
But then the
it
second
does.
one was was
Yeah,
not as much enhancement. I thought
incrementally,
maybe we did,
incrementally,
sure.
it might be a little less, but they are very difficult to get.
Right.
I don't think a lot of doctors recognize these kind of floaters because they are behind the natural lens of the eye, and when you're looking on the inside, you're looking basically beyond them, or you're looking at stuff further back. So it's not recognized. They classically, the patient perceives it as like a windshield wiper or a grease smudge that comes over their vision. When they look down, I've done a bunch of dentists with this problem, but it can be done. By the time we put everybody's little video testimonial, we'll probably have enough for a scientific paper. But for those doubters out there, and for patients who have ophthalmologists who do doubt, please show them the video, and rather than wait for a double-blind, cross-controlled study, which might occur before one of us is dead, just ask the patient, and you're a happy patient, right?
It was like a big smudge. You always thought somebody had them on my contacts, or I thought I had it on my glasses. But that entirely went away the first time. But then I would have a little annoying one kind of fly by once in a while. That didn't change too much the second one. But the third one, that went away a lot. So no, without question. I'm here for the fourth to just try to enhance it a little bit more if possible.
A little
If
bit.
not-
We just,
not, I'm a happy camper.
and I always stress to patients, more is not better.
Right.
Sort of like a breast augmentation, more is not always better. There's a point where it's just right.
Right. Well, words can't describe how happy I was after the first treatment.
Yeah, and there we are doing it there, right behind the crystalline lens, and it was tough.
And painless. Well,
It was tough mentally to do this for me. The concentration
Oh,
required, and you have to have the proper equipment.
Sure. But
Anyway.
for me, painless as far as no pain.
Right.
But very,
Right.
very, very grateful I came here.
Great. Well, you're a great patient, and I hope when you get back to Tampa and you visit an ophthalmologist, you tell him what was done.
Definitely will.
He probably won't believe it anyway, but tell him they can always call me.
Definitely
All right.
will. No question at all.
Okay.
Thank
Thank
you
you.
very much, Doctor.
Sure.